good evening everyone. Welcome to OET Speaking Speculation Live. This is me, Richard Caroline, joining you from Neethu's Academy. So yes, it's another Wednesday. We are here to look into a very detailed mock test presentation for you guys, and also followed by that we'll be having a discussion of the card that we just presented for you. Okay, so yes, today we will be looking into a very recent exam model card, and here you have to talk to the patient who has been recently diagnosed with type 2 diabetes mellitus, and basically ഒരു recent diagnosis ആകുമ്പോൾ ഫോളോ അപ്പിന് വരുന്ന ഒരു പേഷ്യൻറ്റോട് നമ്മൾ ചോദിക്കുന്ന കാര്യങ്ങൾ എന്തൊക്കെ അഡ്വൈസ് ആണ് കൊടുക്കുക, എന്തൊക്കെ ലൈഫ് സ്റ്റൈൽ ചേഞ്ചസ് വരുത്തണം, ഫുഡിൻ്റെ കാര്യം, ഡയറ്റിൻ്റെ കാര്യം, അതുപോലെ തന്നെ എക്സസൈസിൻ്റെ കാര്യം, ഇങ്ങനത്തെ ഒരു പ്രസൻറ്റേഷൻ ആണ് ഇന്നത്തെ കാർഡിൽ വരുന്നത് കേട്ടോ. സോ ആഫ്റ്റർ ദ എൻറ്റയർ മോക്ക് ടെസ്റ്റ് presentation we will be getting into the detailed discussion about how each task can be done. Like okay, already നിങ്ങൾക്കൊരു presentation കാണാം, അതിനോടൊപ്പം തന്നെ സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ കുറച്ചുകൂടി ഈസി ആയിട്ട് എങ്ങനെ ചെയ്യാം എന്നുള്ളതിൻ്റെ ബേസിസിൽ വിൽ ബി ഹാവിങ് എ ഡിസ്കഷൻ ടുവേർഡ്സ് ദ എൻഡ്. സോ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് ഓൾ ഓഫ് യു വാച്ച് ഇറ്റ് ടിൽ ദ എൻഡ് ഓഫ് ദ സെഗ്മെൻറ്റ്. ഓക്കെ, ആൻഡ് മേക്ക് ഷ്യൂർ നമ്മുടെ ഡിസ്കഷൻ സ്റ്റാർട്ട് ചെയ്യുന്ന സമയത്ത് നിങ്ങളുടെ സെൻറ്റൻസസ്, നിങ്ങളുടെ സജഷൻസ്, ഈ ഒരു ടാസ്ക് ഇങ്ങനെ കൂടെ ചെയ്യാം, ഇതൊക്കെയാണ് ഞാൻ ചെയ്യുന്ന രീതികൾ എന്നുള്ള രീതിയിൽ നിങ്ങൾക്കുള്ള ഷെയർ ചെയ്യാനുള്ള പോയിന്റും കാര്യങ്ങളൊക്കെ നിങ്ങൾ കോമെൻറ്റ് ബോക്സിലേക്ക് ഇടുക. സോ അവിടെ ഐ വിൽ റീഡ് ദ സെൻറ്റൻസസ് ആൻഡ് ഐ വിൽ ഗീവ് യു ദ ലൈവ് കറക്ഷൻസ്, ആൻഡ് ഇഫ് ദ റിയലി ഗ്രേറ്റ് സെൻറ്റൻസസ് you are actually helping others to learn new sentences and also do the role play better. So yes, that's all about the overview about how we will be doing this particular live segment today. So without wasting much time, let's get to the mock test.
This is the recording of Occupational English test held at Neethu's Academy on 18th of June 2025. The candidate's name is Richard Caroline and the candidate number is 6728190. The interlocutor's name is Amy Sebastian and the interlocutor's number is 56739. This is the recording for the profession of nursing. Good evening.
Good evening.
Can I see your identification, please?
Yeah, here it is.
Thank you.
Yes.
Remember, this is an assessment of your English language proficiency, not your medical knowledge. So speak naturally. We will start with the warm-up session, and it is no way assessed. So you can speak naturally.
All right.
Okay. Over to the warm-up sessions. Introduce yourself.
Hi ma'am, my name is Richard Caroline and I am a BSc nursing graduate. I graduated from XYZ University and currently I work in the critical care unit.
So how long have you been working?
I've been working as a nurse since 2020.
Okay, so do you think it is important to continue the nurse's education?
Certainly, it is imperative that the nurses continue their learning for many reasons. So if I have to say a couple of those, first of all, the profession of nursing, like any other profession, it always gets updated. So it is important that we continue learning to keep par with it. Like we need to be updated with that. And also, if I'm not wrong, to complete specific hours of continuous learning is mandatory when it comes to the nurses registration or renewal of it. So I think it's really important that you continue the nursing continuous learning.
Okay, cool. So, do you think there is gender disparity in your profession?
That's a debatable topic. Traditionally, there were a lot of disparities, not just from the side of the management or authority, but also from the preferences side of the patients. Because there was a time when patients always preferred, female nurses, especially female patients would only prefer female nurses. But the time has changed. The light is turning on that side right now, and we can see now just a teamwork. There is no specific gender disparity right now.
Okay, well, so now we will proceed to the role play.
Okay.
So, this is your role play number 1, and you will have 3 minutes to prepare, and you are free to ask any questions you may have during this time. After that, you will have 5 minutes to speak. Okay. So, this is your cue card, and your 3 minutes starts now.
All right.
This is the end of your preparation. Now you have 5 minutes to start the conversation.
Okay. Good evening.
Good evening.
My name is Richa. I work as a registered nurse in this clinic. Please state your name and age for me.
My name is Elizabeth Gonsalves and I'm 56.
You're Elizabeth Gonsalves and you're 56. Okay. Yes, I can see your details on the system here. And if I'm not wrong, you have a follow-up today?
Yes.
Okay. Is it okay if I go by your first name?
Oh, absolutely.
All right. Thank you, Elizabeth. So from your report, I can see that you have been recently diagnosed with type 2 diabetes mellitus, if I'm right. Yes?
Yes.
Okay. Then today is your follow-up. So I would like to discuss a few things with you. But before that, tell me, how are you feeling about all of this?
I would say I'm really anxious about it. I'm quite worried about everything, and because I don't know what to do with it and how to manage it, so I'm really worried, and in a way I can say I'm panicked.
Elizabeth, I totally understand that you might be having a roller coaster of emotions right now.
Yes.
To learn that you are sick or ill is emotionally daunting. I totally get it. I totally understand where this is coming from. But all I have to tell you is that you have been diagnosed with type 2 diabetes mellitus, and I can reassure you about this condition because this is quite manageable with medication, proper diet, lifestyle modifications, and if it gives you any peace of mind, I can assure you that many people live normal lives with proper control. Okay, so I hope this is actually making you feel a little better right now.
Yeah, I think yes.
Okay, so Elizabeth, tell me, do you have anything in particular to ask me about it?
Yeah, since the moment that I was diagnosed with this, I was wondering what would have led to this, or what are the possible causes of this.
Okay, I totally understand you have some concerns about the cause. It's quite natural to feel this way. So let's discuss that, okay?
Yes.
Well, you need to understand there can be various causes behind this particular condition. To list a few, genetics is one of the main reasons. If it runs in your family, there is high chance that you might also have it. Being overweight or obese, or inactive, being inactive or lack of physical activity is another contributing factor. Having an unhealthy diet and a sedentary lifestyle are also other factors of type 2 diabetes mellitus. So I hope it is clear to you.
Yes, it is.
Okay, so well, in that case, I would like to tell you the importance of following the instructions that I'm going to tell you right now. So please make sure that you come for the regular monitoring, and also do it by yourself. We'll guide you on how to regularly monitor your blood glucose level, because we need to understand everything is going well and you are just doing fine. And it is also important to follow a very healthy lifestyle. It will help to prevent the complications like nerve damage or vision problems, which are all the long-term consequences of diabetes. So I hope you understand that it is important to follow the instructions as given by the doctor. Yes?
Yes, I do.
All right. Well, having said that, I would also like to talk to you about the dietary changes. Okay. So before we discuss that, let me ask you, do you have any dietary preference?
No, I don't. I just eat everything that comes by.
Okay, I understand. Now, speaking about the dietary changes, please include more whole grains like brown rice, oats into your diet. Okay. And it's also important to add more fresh, greeny, leafy vegetables and fruits. And when you're eating fruits, make sure that you're not eating ones which are really high in sugar. Okay, so that is one point you need to keep in mind, like mangoes, bananas. This can actually add on to the sugar content in your body. Okay, so I can understand that it might be your favorites, but still please try to avoid. Okay, I understand that. And it is also important that you avoid refined sugars. Okay, white bread, sweetened drinks, and it is important to have a portion control. You can eat frequently, but make sure that you have a portion control. And Elizabeth, I can totally understand changing your dietary preferences or dietary habit is not going to be that easy initially, but it is important that you have a very strict diet. Only then we will be able to manage your present condition. So I hope you understand the seriousness of it. Yes?
Yes, I do. It is a bit difficult, but definitely I will.
I'm glad to understand that. I'm glad to hear that. Now, do you have any questions to ask me?
Yeah, I mean, like after being diagnosed with this, there were people who told me that physical activity is something that is important that I need to do, but I find it very difficult to do any kind of physical activity. I'm quite lazy with that.
That's a very natural response that I get from you, because it's very common that we find really lazy to do the physical activities. But still, what you heard is right. It is important to have some physical activity in your life. It's not at all advisable to be inactive.
Oh, well, Richa, your time is up.
All right. Thank you so much.
Thank you.
Ready? Go.
Yes, welcome back everyone. So that was the entire mock presentation of this particular roleplay card, and I hope all of you got an idea about how this card can be done. Yes, I was not able to complete all the tasks because I was explaining more in detail, and my rate of speech was also kind of like on the lower side of the moderate level. So yes, it is important that you organize the entire time efficiently to complete everything, and also in this particular context, the interlocutor was also giving me lengthier explanations. Okay, it was going like a very good conversation, but at the same time she was also adding long explanations, so it is a possibility that your interlocutor might also use lengthier explanations to your question. So at that time what you have to do is, interrupting the interlocutor is not the right thing to do, but it is important that you plan your coming statements in a way which can be not too long, not too short, but having all the right information relevant to the context, and you're finishing it off. Okay, so now without wasting much time, let's get into the discussion of how each point each of these tasks can be done, how we can elaborate that into different sentences and things like that. Okay, so now let's discuss it with the card. So I'll display the card right now. Yes, good evening everyone. Suma, Jubi, Adra, yes, good evening. Alright, so in this particular card you can see that it is given as the hospital outpatient clinic, and when you read the background information you can see you're talking to a 56-year-old male or female diagnosed with type 2 diabetes mellitus. The patient is attending a follow-up visit after being recently diagnosed. She or he is feeling anxious and unsure about how to manage the condition. Your job is to explain the condition, offer reassurance, and provide advice on management. And your first task is to confirm the reason for the patient's visit, that is follow-up. After that, ask how he or she feels about the diagnosis. Okay, now coming to the point, when you look at this context, you can see the word follow-up. So when it is a follow-up, technically speaking, the patient is under our care, like the care at the hospital. So definitely the data of the patient will be available at the hospital. So that makes it a non-case. Now my next question is this a first category non-case or second category non-case? So now if you have listened to the entire presentation, it is pretty much clear for you which category it is. So let me know in the comment section, what do you think it is this? Like, is it a first category non-case or a second category non-case? Yes, Angel, hello, good evening. Let me know in the comment section, all of you. Which context is this? Is this the first category non-case or the second category non-case? Based on the detail given here. You know it is a non-case because this is a follow-up visit. Now we need to find out which category non-case it is. Based on that, we have to draft the introduction. Based on that, we have to decide on whether my self-introduction is needed, or do I just need to start by greeting and moving on to the context like I know this patient. So what is the right context and what is the right thing to do in this context? Yes, Jubi has mentioned this is the first category non-case. Excellent. Nowhere in the card it is mentioned this is your patient, or there has been instances where you have spoken to this patient before, because you can clearly see the points mentioned in the background information. It is not given like this is your patient, or you have been taking care of this patient, or this patient was under your care, or this is a just examined case. Nothing of these sorts are mentioned here. So this is not a second category, this is completely a first category non-case. Now, when you're dealing with the first category non-case, as you have witnessed in the mock test, it is important that you greet, you do the introduction, self-introduction. You have to say who you are, because yes, we might know the name of the patient, but it is not necessary that we are talking to this patient itself, because it's a follow-up. And also it is not necessary that the patient would know your name, right? So you have to definitely say who you are. And I asked for the name of the patient in the role play as well, like for the verification. So it is important that you do for the verification as well. Okay, now after that, it is important for you to check with the name of the patient, and then confirm the first task, which is follow-up. So it is given here, the patient has come for the follow-up and you have to confirm it. So the way I have confirmed it is like, I got the name, and when she said my name is Elizabeth Gonsalves and she's 56, I said yes, I can see it on my file, on my system, that you have a follow-up today, isn't it? So she said yes. So that is the way I'm confirming that point. So this is the easiest method you can do when it is your follow-up. So if you come across a similar context like this, or in the portrait pattern vannal, remember, this is the right way to do it. Okay, so keep this in mind. Now let's look at the next point. Ask how he or she feels about the diagnosis. Okay, yes, Suma, this is the first category, non-case. You guys can please let me know the introduction that you would be going with in this context too. Okay, I don't want you to type the long sentences. You can tell me the steps that you would be doing, like greet, whatever the points that is, like you'll be telling or confirming the reason, after that which connector you'll be using to move on to the next point, etc. So let me know in the comment section about that too. Okay, now ask about how he or she feels about the diagnosis. I asked the question, if I recollect correctly, I asked, so before we get into further discussion, or before we discuss few things regarding your condition, I would like to know how you've been doing, amidst of all of this, or how you've been dealing with all of this. So the patient mentioned, I'm not doing great, I'm having a very rough time, I'm actually worried, panicked, etc. Okay, so we can understand, yes, the patient just had a diagnosis, so definitely the patient will not be happy about it. The patient will be quite worried, and the patient will have his or her concerns about, okay, what is wrong with me, why am I having this, what are the points that I need to keep in mind, and etc, etc, about the management, the recovery, the causes behind it. So too many questions would be there. So based on that, I have to make myself prepared to give a good acknowledgement statement before I move on to the next task. And in this context, my next task is indeed reassure about type 2 diabetes. So my next task itself is telling me this is how you can move on to your next point, because you can just, you just have to reassure it. Okay, so what I did is, I mentioned, well, I can understand, I gave an acknowledgement statement, I understand, I don't actually recall the exact statement that I mentioned, but it was something like, I understand how difficult it might be for you, or hearing a diagnosis can be emotionally daunting, or hearing that or learning that you are sick or ill can be emotionally daunting for you, and I perfectly understand where this is coming from, but I can reassure you that type 2 diabetes mellitus is a manageable condition with proper medication, diet, lifestyle changes. And if it gives you any peace of mind, I reassure you that many people live normal lives with proper control. So usually what I do is, whenever we see the word reassure, we use the word if it gives you any peace of mind right there itself. Alright. So in this context, I just did a different method. Okay, I did not use that phrase if it gives you any peace of mind with the word reassure, but what I did is, I use the same context which is mentioned there, reassure. So I created a statement by saying, I reassure you type 2 diabetes is a manageable condition. But coming down, when I saw that many people live normal lives with proper control, that sounded, or that looked to me like I am using that statement to motivate the patient. So that is the best place to use this particular phrase. That's something that came to my mind, so I decided to use it there. So when I said that statement, I could hear myself in my mind like, okay, that was a good usage. You blended that phrase correctly and accurately into that context very smoothly. So that is how you need to sound natural and be very confident and spontaneous with the phrases that you are learning. നമ്മൾ പഠിച്ചു വെച്ചിരിക്കുന്ന കുറേ കാര്യങ്ങളൊക്കെ ഇതുപോലെ നമുക്ക് ബ്ലെൻഡ് ചെയ്ത് സംസാരിച്ചുകൊണ്ട് പോകുമ്പോൾ, ഓക്കെ, ഇത് ഇവിടെ യൂസ് ചെയ്യാം, ഇവിടെ ഈ കോണ്ടെക്സ്റ്റ് പറയാം എന്നുള്ള രീതിയിൽ അത് പറഞ്ഞു പോകാനായിട്ട് സാധിക്കണം. ഇറ്റ് ഈസ് വെരി വെരി ഇമ്പോർട്ടൻറ്റ് ടു ഡു ദാറ്റ്. ഓക്കെ, നൗ വൺസ് ദാറ്റ് ഇസ് ഡൺ, ഐ ആസ്ക്ഡ് ദ പേഷ്യൻറ്റ്, ഐ ഹോപ്പ് ഇറ്റ്സ് ക്ലിയർ ടു യു. She said, yes, it is clear to me. Now, my next question is, find out any concerns or questions. Okay, so I just directly asked the question. So do you have any concerns or questions? Do you want to ask me anything? So the patient would ask me, yes, ever since the diagnosis, I'm really concerned about the causes. I just want to know what are the possible causes of this condition. Okay, so yes, before we move on to the task, let me read a couple of the comments that I'm getting, and I want everyone to comment down. Yes, good evening, Sri Kumar. Okay, so Suma has mentioned, first category non-case. For the confirmation purpose, can you help me by stating your full name and age, please? That's the right statement. Just a moment, let me find your file. Excellent, good. So Juby has given greeting, self-introduction, verification, purpose of visit, and initial assurance. Excellent, excellent. Suma mentioned, yes, I find your file. Okay, so it is not find, it has to be found. Okay, I found your file, and from that I can see that you've been recently diagnosed with type 2 diabetes mellitus. Okay, excellent. So now I am going to give you a small task, okay, and I wish that I really want that all of you to comment down and let me know the different sentences that you can use for find out any concerns or questions. It's a very basic question that I'm asking you, because there is not even a single role play without this question. You will definitely have to ask the question, do you have any concerns in the role play? But I have seen myself and heard myself students repeat, do you have any concerns, do you have any concerns in the role play, like more than 2 to 3 times. It is not right. You need to be using different sentences for the common words or sentences like these. So you need to know, okay, there are different versions of this. It is not just one way of doing it. It can be done in a different way too. So I want you guys to comment down what are the different sentence constructions for find out any concerns or questions. I'm going to give you 30 seconds time. Okay, just let me know whatever sentences that you know, like do you have any concerns, is there anything you would like to ask me, and so on. So I'll give you 30 seconds time. Please let me know in the comment section. I'll wait for 30 seconds, and if there are no comments, I'll give you my sentences, no problem at all. But still, let me know in the comment section what you know about it and what are different sentences that you can use. So when others comment, it is actually a platform so everyone can look into it, and those who don't know about it, they can learn from it. They'll get an idea about, okay, this can be done like this too. Why am I repeating the same thing when I know this can be done like this? ഇങ്ങനെ ചെയ്യാമല്ലോ, പിന്നെ എന്തിനാണ് എപ്പോഴും ഇത് തന്നെ ചോദിച്ചുകൊണ്ടിരിക്കുന്നത് എന്നുള്ള രീതിയിൽ നമുക്കത് പഠിക്കാം. So let's share together and learn it. So yes, you have 30 seconds time. Let me know in the comment section what are the different versions of sentence construction for find out any concerns or questions. Yes. In the meantime, let me read a sentence by Juby. It is understandable that you are nervous about your condition. Please don't worry. It is quite natural. I'm happy to help you. Very good. Very, very nice. Very beautiful statement. So instead of saying I'm happy to help you, you have to say I am here to give you all the information you need to know. That would be much better. Get on. Now, Juby mentioned if there are any concerns to be addressed before moving further. Okay, if there are any concerns to be addressed before moving further, it's not right. Avada ifum ആ ഒരു സെൻറ്റൻസിൻ്റെ എൻഡും തമ്മിൽ മാച്ച് ചെയ്യുന്നില്ല ജുബി. അപ്പോൾ ഈഫ് എന്നുള്ള രീതി മാറ്റിയിട്ട് ഈഫ് ദെയർ ഈ ഒരു കോണ്ടെക്സ്റ്റിൽ വേണ്ട. ആർ ദെയർ എനി കൺസേൺസ് ടു ബി അഡ്രസ്ഡ് ബിഫോർ മൂവിങ് ഫർദർ വുഡ് ബി കറക്റ്റ് കേട്ടോ. അവിടെ ഈഫ് വന്നാൽ നമുക്ക് അങ്ങനെ മാറ്റിയിട്ട് അങ്ങനെ പറയാൻ പറ്റില്ല. യു ഹാവ് ടു ചേഞ്ച് ദ സ്റ്റേറ്റ്മെൻറ്റ് ഇൻ ടു ഇഫ് ദെർ ആർ എനി കൺസേൺസ് ടു ബി അഡ്രസ്ഡ് ബിഫോർ മൂവിങ് ഫർദർ പ്ലീസ് ലെറ്റ് മീ നോ ഓർ പ്ലീസ് ആസ്ക് മീ എന്ന് കൂടെ പറഞ്ഞാലേ അത് കംപ്ലീറ്റ് ആവുള്ളൂ. അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ എന്ന് പറഞ്ഞ് നമുക്ക് എൻഡ് ചെയ്യാൻ പറ്റില്ല. അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ എന്നോട് ചോദിക്കൂ എന്ന് പറഞ്ഞ് എൻഡ് ചെയ്യാൻ പറ്റുള്ളൂ അല്ലേ. ഓക്കെ. So Suma has mentioned, is there anything else you would like to clarify with me? Okay, you would like to clarify with me. So clarify with me is wrong because you're not clarifying with the patient is not clarifying with you. You are clarifying with the patient. Okay, so you have to ask, is there anything else you want me to clarify for you? You want me to clarify for you. Do you have anything else you would okay, then Anju has mentioned, is there anything else you would like to ask me? That's an excellent question. So in this context, you all have given the point else, but let me tell you, we have just started the role play alle iduvare concerns endengilum avaru chodicho. They did not ask any concerns alle. So this is kind of like the first concern. So is it okay to use the word else? വേറെ എന്തെങ്കിലും ഉണ്ടോ എന്ന് നമുക്ക് ഒന്നും ചോദിക്കാത്ത ഒരാളോട് ചോദിക്കാൻ പറ്റുമോ? ഇറ്റ്സ് നോട്ട് പ്രാക്ടിക്കൽ അല്ലേ. അപ്പോൾ അവിടെ എന്ത് ചെയ്യണം? യു നീഡ് ടു എലിമിനേറ്റ് ദാറ്റ് എൽസ്. ഈസ് ദർ എനിത്തിങ് യു വുഡ് ലൈക്ക് ടു ആസ്ക് മീ? Is there anything that you would like to discuss with me? Is there anything bothering you? Do you have any specific questions? Is there anything particular in your mind that you would like to talk to me about? എന്നൊക്കെ മാറ്റാട്ടോ. Else is not advisable here. കാരണം വേറെ ചോദ്യങ്ങളൊന്നും ഇല്ല. അപ്പോൾ ഒരു ചോദ്യമെങ്കിലും വന്നിട്ടാണ് നിങ്ങൾ അത് യൂസ് ചെയ്യുന്നതെങ്കിൽ absolutely fine. No problem. Go ahead. Okay, but if you are asking this question and there are no other concerns from the patient's end also so far, it is not advisable you do it. So you have to stop that and then you have to ask the question without the word else there. Yes, Juby, do I have to address anything else to you? No. Do I have to address anything else to you? Again, the word else is problematic there. Do you have any concerns or questions you want to clarify with me? Okay. Do you need any further information from my side? So usually when you say the point my side, in English we actually use my end. Do you want to ask, do you need any further information from my end? My end, my side എന്നുള്ളത് അങ്ങനെ നമ്മൾ പറയില്ല. It's not a kind of like ഒരു കുറച്ചൊരു awkward usage ആണത്. It's not my side, it's my end. GB has mentioned, is there anything you would like to share with me? Okay, yeah, good. So I gave you a couple of statements. Please take a note of it. Okay, I'll repeat the sentence twice. So if you're writing it down, you will get enough time to write it down. Okay, so please write the heading, do you have any concerns? Our heading എല്ലാവരും എഴുതിക്കേ. Is there anything else that is bothering you? Again, to be else, we don't need else. Is there anything that is bothering you? Would be fine. Okay, now all of you write this heading. Do you have any concerns? Let's learn different sentences for that. Do you have any concerns? The first sentence. Is there anything you would like to ask me? Is there anything you would like to ask me? Is there anything you would like to ask me? Okay, do you have any particular concerns? Do you have any particular concerns troubling you? Do you have any particular concerns troubling you? So is there anything you would like to ask me? Second one, do you have any particular concerns troubling you? Do you have anything in particular? Do you have anything in particular to ask me? Do you have anything in particular to ask me? Number 4, do you want me to explain? Do you want me to explain or clarify anything? Do you want me to explain or clarify anything? Do you want me to explain or clarify anything? Next one, the last one. Is there anything in your mind? Is there anything in your mind? Is there anything in your mind that is bothering? Is there anything in your mind that is bothering? Any bothering എന്ന് ചോദിക്കുമ്പോൾ that's a very simple question. Is there anything in your mind that is bothering എന്ന് ചോദിക്കാം. ഇനി bothering ന് പകരം instead of the word bothering you can ask, is there anything in your mind that is weighing you down? WEIGHING, weighing you down. Is there anything in your mind that is bothering എന്ന് ചോദിക്കാം. അല്ലെങ്കിൽ is there anything in your mind weighing you down? Weighing, WEIGHING, weighing you down. So these are the 5 sentences that you can try instead of repeatedly using do you have any concerns. So I was also writing as and when I was reading the sentences to you, okay, because those were spontaneous statements. So the first one is there anything you would like to ask me? Do you have any particular concerns troubling you? Do you have anything in particular to ask me? Do you want me to explain or clarify anything? Is there anything in your mind that is bothering, or is there anything in your mind that is weighing you down? So these are some of the statements that you can try, which are really nice statements for that matter. Okay, now, so you can try these statements instead of repeating do you have any concerns, do you have any concerns, repetition kootanda. Instead you can try these really beautiful statements. Okay, now let's move on to the next point. Yes, Anjani Devi, let me reassure you, your condition is totally manageable with medication, dietary modification and lifestyle changes. Try not to worry, we are here to help you. Before going further, do you have any concerns to share with me? Excellent, that's a really great statement. Do you have any concerns to share with me? Yeah, that is a good question that you can ask in this context. So I hope all of you have taken note of the points that I have discussed with you. Angel Alex, are you any questions? So are you very Lada? Do you have any questions to be addressed? That would be fine. Do you have any questions to be addressed? Please ask me freely. Let you ask me freely, Alada. Please ask me freely. Okay, so now let's move on to task number 3, which is explain the possible causes. So even at we are asking this question. So let's pick one question from the list that we have. Let's go with point number 5. So Miss Elizabeth, is there anything in your mind that is bothering you? So the patient said, yes, I would like to know about the causes. So now we are going to explain the possible causes. How can we do that? Well, I totally understand you must be concerned about the possible causes, but Elizabeth, let me explain the possible causes to you. There are various causes such as genetics, being overweight, obese, or lack of physical activities, having an unhealthy diet, or sedentary lifestyle. These are all different contributing factors of type 2 diabetes mellitus. I hope it's clear to you now. Patient says yes. Well, in that case, I would like to tell you the importance of following the instructions given by the doctor. It is really important that you regularly monitor your blood glucose level and you follow a healthy lifestyle to prevent the complications such as nerve damage or vision problems, which are pretty common in the case of diabetes. So if you follow the instructions correctly, we can prevent the possibilities of complications to a great extent. So I hope you understand the seriousness of it. The patient says yes. Since my next task is also information giving regarding the instructions or suggestions, I just used a connector additionally. Additionally, I would like to talk to you about the dietary changes. So please make sure that you add more whole grains like brown rice, oats, fresh vegetables and fruits except high sugar fruits like mangoes and bananas. And it is important that you avoid refined sugars like white bread, sweetened drinks, and also have a portion control. So please make sure that you follow all these instructions correctly for managing your diabetes. Is that clear to you? Or do you think it's doable? The patient said it is going to be difficult, but I'll try to do that. And at the same time, I also asked the question, okay, so do you have anything else to ask me? Because already we asked, do you have any questions in your second task? So now you can use, do you have anything else to ask me? So patient asks the question about the physical activity, and this is where I couldn't complete the task. So now let's see how we can do this task. So the point is, speaking about your physical activity, yes, it is important to engage in physical activities for at least 30 minutes. You can try some walking, cycling, or light aerobic exercises at least 5 days a week. And you can try stretching, yoga for flexibility and relaxation. So please make sure that you find at least 30 minutes every day for 5 days in a week to be active in your life, and this can do wonders. This can help you to manage your diabetes to a great extent. So please definitely do it. Is that okay with you? She says, yeah, that's okay with me. Again, I have a transition given. Do you have any other concerns? So when the patient says, the point next to me, yes, the medication, well, yes, the doctor mentioned to take the medication, and say for example the patient said the name, because patient and area patient medicine so patient's like the doctor prescribed metformin for me. So can you tell me about that? So you're going to explain about the prescribed medication. So you can say, Elizabeth, yes, about the prescribed medication, the doctor has given metformin 500 mg, which has to be taken twice daily with food, and I'm just letting you know there can be or there may be some mild side effects like nausea or headache, but please don't worry. If at all you experience any of these, please seek medical help in the Barnamadi. That is how we can do it. And once you have completed that point, you can ask like, so is there anything else I can help you with? And the patient says no, everything is clear to me. So you can say, well, I hope everything is doing fine, and as far as our discussion is concerned, and by my observation, I think that everything is going fine right now. So please wait till you meet the doctor as well, and it is important that you come for the regular follow-ups and also constant monitoring of your blood glucose level. Okay, so please wait here, let me know, I will let you know when the doctor is here എന്ന് പറയുമ്പോൾ ആ ഒരു പോയിന്റ് കഴിയും. ഓക്കെ, ഇവിടെ നമുക്ക് ആ ഒരു പോയിന്റ് അവർ ക്ലിയർലി മെൻഷൻ ചെയ്തിട്ടില്ല, ഡോക്ടറെ കാണണം എന്നുള്ള കാര്യങ്ങളൊന്നും എടുത്ത് പറഞ്ഞിട്ടില്ല. പക്ഷേ വാട്ട് യു ക്യാൻ ഡു ഇസ് ആഡ് ചെയ്യാം. ടെക്നിക്കലി സ്പീക്കിംഗ് നമ്മൾ നഴ്സുമാർ മാത്രം കണ്ടിട്ടായിരിക്കില്ല അല്ലേ പേഷ്യൻ്റ് തിരിച്ച് ഫോളോ അപ്പിന് പോകുന്നത്. ദേ വിൽ കം ടു ദ ഹോസ്പിറ്റൽ, ദേ വിൽ സ്പീക്ക് ടു യു ഫസ്റ്റ് ആൻഡ് ദെൻ ടു ദ ഡോക്ടർ കണ്ടിട്ടായിരിക്കും പോകുക. അപ്പോൾ നമുക്ക് എന്താ ചെയ്യാം, ആ ലോജിക്ക് വെച്ചിട്ട് പറയാം, സോ പ്ലീസ് വെയിറ്റ് ഹിയർ, ദ ഡോക്ടർ വിൽ ബി സീയിങ് യു സൂൺ എന്ന് പറഞ്ഞിട്ട് നമുക്ക് വൈൻഡ് അപ്പ് ചെയ്യാം. സോ ദിസ് ഈസ് ദ ഓവറോൾ എക്സിക്യൂഷൻ ഓഫ് ദിസ് കാർഡ്. So I hope everything is clear to you guys. So you have seen the presentation of this, so you can also look into that, the sentence construction. So please go back to the presentation and look into the sentence construction and see how the sentences were constructed. And I have added some additional points before and after the main task explanation is given here, just to elaborate the points. And keep in mind that whenever you are doing it, if your interlocutor is also giving you long explanations, which is not just confined to one or two sentences, if she is speaking for a long time, remember your coming task has to be done in a way that it has to be constructed to be more concise, and you need to speed up a little bit. Okay, it's not like you need to rush. It hasn't be like you're rushing to finish everything, but still you need to keep in mind that okay, your time is running out, you have few more tasks to be done, but your interlocutor is taking some time to explain the points. Okay, so make sure that if that is happening, you reduce the interactions in the coming tasks. Okay, ഇനി അങ്ങോട്ടുള്ള ടാസ്കുകളും ഇടയ്ക്കും ഈ ഇൻട്രോക്യൂട്ടറെ കൊണ്ട് സംസാരിപ്പിക്കുന്ന ഇൻട്രാക്ഷൻസ് കുറയ്ക്കാം. Maybe just give close-ended questions, so you will just get yes or no questions. പിന്നെ do you have any concerns ന് പകരം you can just move on. But in this particular context, you have more of interactions. You have to ask different questions like, do you have any concerns in like around 3 or 4 tasks in this particular cue card. So it happens. Okay, so but not worry, you just make sure that whatever you can complete, how many tasks you can complete, that has to be highly conversational, then you will definitely pass. Don't worry about it. Okay, so I hope all of you got an idea about how this card can be done, and thank you very much for the constant commenting and the messages that you're sending via comment session. So I'll be seeing you guys next Tuesday with another exam model card discussion. So until then, take care all of you and have a very good evening.